So my name's Donald McCaskill. I'm the chair of the Charter Group, which over the last 18 months to nearly 2 years has been developing Scotland's first national charter on bereavement for adults and children. And absolutely delighted to have you here at what we hope will be the first in a series of webinars in which we will explore one or two themes each slot. Can I just again encourage everybody to put themselves onto silence? Otherwise, I have that nasty power bestowed upon me, which is to mute everybody, which I've never used because it would feed into my megalomania and that would not be good. We have a really interesting program of diverse topics this afternoon. And so the format is that in a brief moment, I'm going to invite Janice Turner from NES Scotland to update you on the work of the Charter Group and the Bereavement Charter. And then we have three speakers who I'll introduce in turn, looking at three distinct areas of focus. And after that, we break up into small workshop groups, and we've got 6 of those so that we can break the numbers up. Now, you will be randomly allocated a group. If you end up in a theme or a topic that you absolutely do not want to be in, then you have the option to return to the main room, and my colleague Shanice will allocate you to a room of your choice. But can I gently suggest that unless the topic you end up in is something that you really don't want to explore, if you can stay there, it will be better, because we only have half an hour and it'll take a little bit of time to reallocate you. But that option is available to you. So without further ado, I'm delighted to ask Janice Turner from NHS Education Scotland to give us a bit of an update on the work of the Bereavement Charter and the group behind it. So over to you, Janice.
Thanks. So thank you very much for the slides coming up. So as Donald said, this is just like a very quick 5-minute update of an overview of the work that we're doing. So next slide, please. So the Charter Development Group has been created. It's a coalition of organisations. There's currently 33 members of the group, and it represents various, a really wide kind of cross of lots of different inputs. We meet 6 monthly, and we undertake the work that I'm about to tell you about. So next slide, please. So the Charter itself is 13 statements, as you all probably are aware. The Charter guidance notes goes with the statement, and we update that twice a year. Currently, there are 9 additional guidance sections for specific groups in the guidance notes, and they're listed there, so I won't read through them. But we're developing 2 new sections for this summer, and these are for deaths in remote and rural locations and sudden and traumatic death. We would be very interested in the chat or in any of the workshops. If there's other areas you think that we should be considering, then please let us know. Next slide, please. So we've also developed a charter mark, and the charter mark is for organisations to use if they want to endorse the ethos of the charter. The details to get the charter mark are on the Scottish Care website, and the link's there. Currently, 7 NHS boards out of the 14 in Scotland are using the mark, and 11 organisations, but that grows all the time, and that's just the ones that have actually let us know they're using it. I'm sure there's others. And as I said, the link to the mark and other resources is down at the bottom of that slide. Next slide, please. So we've also undertaken social media campaigns. We've run a couple. We did one in 2020 for 4 months, and we did one this year running up to the election. The one that we've just completed was very successful. We had 248 tweets retweeted and 602 likes, and we had 18 organisations tweeting. Next slide, please. And a big piece of work that we're quite excited about is we're developing our first charter animation. This is in an attempt to make the 13 statements come to life and make them much more engaging and not just on a piece of A4 paper, and actually be much more accessible to everyone. So that is well underway, and we expect it to be completed potentially the end of this month or in June. And once we have completed, that's where you'll be able to find the animation. So I think that is, next slide, thanks. I think that's an overview of the main pieces of work the Charter Group do. As with this presentation, all the presentations and information will be available after the webinar. And because we're on such a tight and full agenda, if there's any questions for me, or if there's anything anybody wants further information on, if you put questions into the chat, I can pick them up as we go, and I'll hand back to Donald. Thank you.
Thank you, Janice. And I hope you can see in that presentation that since we launched the Charter, which is just over a year ago, last April 2020, at really the heart of the pandemic, we've tried to be as busy as possible to achieve the objectives of the Charter, the primary one of which is to build confidence and awareness of issues of bereavement, death and dying in Scotland. And as part of that, we are seeking to reach out to all the new parliamentarians who are, just as we speak, beginning to start their terms of office for the next 5 years, because we believe that the next 5 years has to see significant change in the way in which women and men are supported in their grief and in their bereavement across Scotland. It's therefore very appropriate that this event is taking place in the middle, not quite the middle, because we're only 2 days in, of Demystifying Death Week. And I would encourage you to go to the website and we can put up into the chat the actual web link to find out all the amazing events that are taking place, most of them virtually, this week across Scotland, addressing issues of death, dying, and bereavement and grief in astonishingly wide creative ways. So we're pleased that this event is taking place in this week. Without further ado, I'm going to introduce the first of our 3 speakers, who's Jan Savinc from Napier University. And together with colleagues, they have been undertaking some really fascinating research on the data, which is illustrating that a significant number of people have died in our communities in the last year, as opposed to other settings. So I'm going to hand over to Jan. Jan.
Thanks, Donald, and thanks for this introduction. Let me just share my screen. Can everybody hear me okay?
Yes, thanks, Jan.
Fantastic. And I think you should be able to see the slides as well.
Yes, thank you.
Right, so I'll just briefly present the results of a study we took forward at Edinburgh Napier University and the Scottish Centre for Administrative Data Research. This is sort of a really big picture nationwide data analysis of weekly death registrations published by National Records of Scotland. And what we found is an increased number of deaths at home in Scotland during the COVID-19 pandemic. So I'll briefly present the results of that and then also talk about some of the next steps for further study that we're taking forward. So I'll just dive into the results here. So what this graph is showing is weekly death registrations from the start of 2020 up until to the present day. So the vertical axis here shows the number of weekly deaths, and then on the horizontal axis, there's the week dates, and left hand side corner, that's the start of 2020, and then This little shaded area here is 2021. So all the data that we have available for this year as well. So what this shows is deaths sort of broken down by the place of deaths. So we've got hospital deaths, home and other non-institutional deaths, and then care home deaths. Care homes include hospices as well in this case. And what we're trying to show here is the number of deaths due to any cause. So that's the red lines on these graphs. The blue line shows non-COVID deaths, and the gap between them works to see the number of COVID deaths as well. And the graphs also show the historical number of deaths that happened between 2015 and 2019. So just to put the number of deaths in context. So this shaded area here in the hospital graph, for example, I'll just zoom in onto this. So the shaded area here shows the weekly minima and maxima for the 2015 to 2019 period. And then the dashed line shows the average for those weeks as well. So the first thing to take note of is that the number of deaths is seasonal. So starting at the beginning of the year in winter, that's the peak of the number of deaths, and then it goes down during the summer and then goes back up again as the year ends. So the picture we have due to COVID is that at the beginning of the year, sort of as the national lockdown starts, the number of deaths in hospital shot up quite high. And from the gap between the blue and red lines here, you can see that these are mostly COVID deaths. And then as the hospital sort of adapted to the number of COVID patients over time, you can see that in a couple of months, the number of deaths compared to the historic period has actually been lower than previously. And then at the end of the year, there's a second wave, so the graph shoots up again. And there's a similar picture. I'll move over to the care home section. There's a similar picture in care homes, the really tragic sort of first peak of the pandemic with quite a high number of people in care homes dying due to COVID as well. And then there's a second peak as well towards the end of the year, but also a slightly lower number of deaths compared to historic figures the rest of the year. And then sort of our main finding is that in contrast to hospital and care home deaths, deaths registered at home increased at the start of the year and then have remained high throughout the year up until the present day. And most of these deaths aren't actually due to COVID. So there's some COVID deaths at the beginning of the pandemic in this first section, and then a few in this second peak. But most of the year, these are non-COVID deaths that are sort of at a sustained increased rate. So sorry about that. So we also looked at regional variation of this increase of home deaths. So on this slide, there's a map of Scottish health boards. So on the left-hand side, I'm showing the percentage increase of home deaths compared to the average in 2015 to 2019. And then on the right-hand side, we've got the number of COVID cases in the health board. And so for example, for these more remote areas or the islands, the percentage increase wasn't very high, so between 10 to 20%, for example. And these are also the areas with the fewer COVID cases. Whereas if you look at some of the more central areas, the brighter colors here and in the COVID cases map, these also seem to correspond. So the picture that's emerging is that the increased home deaths were largely due to sort of increased pressures of COVID on the health system. So just to sort of summarize what we found, there's a shift of deaths to home, sort of from hospital and to some degree from care homes. The total increase in home deaths was about 35%, and only 2% of home deaths involved COVID. And the interesting thing is that the increase in home deaths has been sustained and remains to the present day. Areas with higher COVID rates had a larger increase of home deaths. And I don't have time to show the graph for this, but it looks like breakdown of causes of deaths shows that deaths due to cancer, circulatory diseases, and due to other causes increased at home. Whereas, for example, if you look at deaths at hospital, all cause deaths apart from COVID are lower than in the historic period. So this, of course, raises lots of questions. So this is what we're going to be addressing in the next study. These are sort of the three overarching questions that we're trying to answer, which is how did people dying at home differ between pre-pandemic and pandemic periods? We know, for example, that socioeconomic status affects where people die and whether they have access to care. We're looking at what factors can explain the shift to home deaths. So we know that there's pressures from the pandemic, but then there might be things like whether people lived close to a hospital and whether they went to hospital for care, or whether beds were actually available in the hospitals closest to them. And then the main question is really what were the effects on the quality of care received and on palliative care provision. So a 35% increase in home deaths obviously translates to an unprecedented pressure on palliative care services, and also raises questions about what kind of quality of care people were receiving at the end of life. So I'll just outline how we'll do this next study. So we'll be comparing death registrations during a pandemic period, so from the start of lockdown in 2020 to the 5 years prior. And we'll be extracting various routinely collected data, so things like hospitalizations, cancer registrations, community prescribing, and dispensing. There might be an interesting difference here in that people might have been prescribed medicines that are used in palliative care, for example, but they might not have been dispensed because we have some indication that there were shortages of medicines that palliative care teams were facing. We'll be looking at the use of unscheduled care, so calls to NHS 24, A&E visits, ambulance use, and out-of-hour GP visits. And we'll also be using looking at CHI data. So CHI is the individual identifier used by Scottish NHS, and it'll contain information on address changes in the last year of life. So we can look at whether people moved in with their adult children for care, for example. But we'll also be looking at people who might have moved into a care home, because it's likely that during the pandemic, moving into a care home was more difficult and receiving the corresponding care as well. One thing that you'll notice from this is that there aren't any social care data included in here, and that's because nationwide social care data is quite sparse or unavailable, which is why we're having to use various proxy measures for the availability of care, for example. And also my colleague, Dr. Catherine Mahoney, who's also in the webinar today, is taking forward some qualitative work to complement this sort of big picture administrative data research. Right, so finally, I'd just like to thank our various colleagues who supported and provided comments on this research throughout. So from Highland Hospice, Scottish Care, Scottish Partnership for Palliative Care, and Scottish Government. This study is funded by the Economic and Social Research Council. And I've also posted the links to the Scottish Centre for Administrative Data Research. I've been publishing blogs with the study results there. So there's a couple more graphs available. And I've also posted the link to the National Records of Scotland weekly statistics on COVID-related deaths. So yeah, thanks very much.
Thank you very much, Jan. Jan manages to make what is a phenomenally significant piece of original research showing the most dramatic change in the way in which people have died in Scotland that has probably ever happened, at least since modern statistical analysis has started. And at the end there, he highlights some of the real questions which are of real importance to those of us working in the area of bereavement support, is the effectiveness of palliative and end-of-life care and provision with that change, and the potential impact on those who are family members, relatives and friends of those who have died in the community. So very pleased, Jan, for you to come along, put the research so succinctly. I can commend Jan's blogs to you. They're highly readable, and maybe somebody will put the link into the chat. And Jan is joined by several of his academic colleagues who will be in the 2 rooms where these issues will be explored. So thank you very much, Jan, for painting that fairly dramatic change in the last year. And I'm now going to move on to invite Paul Parsons, who will be known to many of you here as the Adult Bereavement Coordinator for St. Christopher's Hospice, sorry, Freudian slip. Columba comes after Christopher, if not theologically, at least in the purpose of today. And Paul's going to speak to the title, How Disenfranchised Grief Has Been Affected by COVID-19. So over to you, Paul.
Thank you, Donald, and thank you for inviting me around today. Yeah, I'm going to spend the next 10 minutes talking about disenfranchised grief. I'm no expert, but I've been with the hospice at St. Christopher's in South London for coming up to 8.5 years now. And we cover 5 of the London boroughs, and 2 of those boroughs we offer community bereavement support as well. But during the COVID environment that we find ourselves in, I've also organised a COVID-19 response team for 3 London hospitals as well. And so that's kind of the experience that I'm talking from today, is how we have felt as a team things have shifted because of the COVID-19 environment that we find ourselves in. So the slides I'm going to share now, I'm not going to talk through every single slide, but I am more than happy to share these with you all at the end. And there's some useful resources as well. I'm also leaning on the experience of being part of the ABSCO team, which is the Association of Bereavement Service Coordinators, which is a nationwide. I know Harriet Hay is here today. She's also part of the exec team, as I am, for the Association of Bereavement Service Coordinators. And we were one of the founders of the National Bereavement Alliance, and many of you will know about Alison Penny's work. And so that I'll be bringing in some of that information as well today. So just thinking about, everybody can hear me and everybody can see the screen, I take it. Nobody's, yeah, thanks, Tom. So just thinking about disenfranchised grief and how that has been affected by COVID-19, we need to go back to the basics of thinking about, well, what grief is. We know that bereavement is the situation that people find themselves in. And of course, attachment is really important to that. About how people respond to a bereavement is very much, one of the indicators is very much about their attachment and how strong or weak their attachment and bond has been with that person. So even in one group of family members, somebody's experience of a bereavement and grief and how they mourn will be different depending on their relationship. And so thinking about grief, we're not just thinking about the emotional responses to grief, but we know that there are physical responses. We know that belief systems are challenged sometimes, and also they're great help if we're looking from a philosophical response and a spiritual response. And so today I'll just kind of throw up some thoughts around that element as well. And later in today's presentation, I'll be thinking about how the effects of mourning have been affected by COVID-19 and what we're hearing from bereaved people. And this is the experience of not just deaths because of COVID-19, but as I say, because of the COVID-19 environment that we're in. So where does disenfranchised grief originate from? Well, it wasn't because of COVID-19. It was Kenneth Docker. Some of you may well know about him and his research in the late 80s. And he first introduced the idea of disenfranchised grief. And in particular, disenfranchisement of grief is around when people can't maybe or don't feel as though they can openly acknowledge their grief, or maybe it's not validated and it's very difficult to mourn and show that you're mourning. And this experience of grief might well prove difficulties with being able to process your grief response. And of course, as we know, processing a grief response over a amount of time, there's no time for grief, there's no timeline that has to happen, but we know that it is really important to express and process what's gone on. And COVID-19 has had a significant effect on people. Also, disenfranchised grief is about where people might not recognise the right to grieve. Now that's important to think about. It diminishes their opportunity to maybe freely express their emotions. And I'll explain a little bit more about that in a few slides' time. So that's where the idea of disenfranchised grief originated from. And as I say, specifically, we're going to be thinking about how some deaths in this environment that we find ourselves in are not as easily validated now that we're thinking as a nation about COVID-19. So some of the complexities. It is important to reflect on risk and resilience. And the risk and resilience has shifted significantly during COVID-19. And my colleagues and doctors at the hospice are much more experienced than I am in thinking about how these are similarities to maybe during the HIV/AIDS epidemic, how certainly we're thinking about from our own community bereavement service, how grief is affected in a similar way with COVID-19 to sudden and traumatic death. So for instance, like suicide, and also how some deaths are more stigmatized. So for instance, like drugs or alcohol, and how do those different types of death, how does that resonate more or less in this environment that we find ourselves in? And certainly we would say that people's grief responses have certainly been interrupted. Their right to grieve has been interrupted by COVID-19. So this is what I was mentioning around stigmatized grief response, where people feel as though they're unable to talk about the death. And that can certainly lead to feeling that their grief is unacknowledged. They might feel as though there's shame involved in talking about their grief. And certainly that in turn can lead to social and emotional isolation. And it's the social and emotional isolation in COVID-19 times that has really affected people's grief response, because people are finding it really hard to grieve, to kind of find small ways of letting go of their grief. And as Julia Samuel has said in the past on some of her talks, this time that we find ourselves in is very much around how grief is much more intense. It's like grief with the volume turned up. And it's really hard for people to dissipate their grief. So if you took into account this comment from a family member around what this family member felt was maybe a more stigmatized grief, I used to tell people my son died in a car crash. People have sympathy for that. They didn't look at me with as much judgment. When I told people who died from drugs, I felt they judged him and me. Moreover, they couldn't sympathize as much. So it's very hard for a family member to be able to talk about their grief in an open and honest way because they feel as though they're going to be judged. And I'll be moving on in a moment about thinking about COVID-19 and where the intensity with the volumes turned up in a similar way. So again, just going back to Kenneth Docker, he suggests that losses in relationships which have legitimacy of being grieved is defined by each society's grieving norms. And our grieving norms have significantly changed during COVID times. Many people are saying when there's a death, was it COVID-19? As if to say, oh, you were so lucky that it wasn't. Or people are getting a different response and saying, oh, it was COVID-19, that must be so awful for you. And that sudden, the sudden deterioration. Or they might be saying, well, at least it wasn't a COVID-19 death. So our grieving norms and our responses to somebody that has experienced a bereavement has shifted and changed in society. And some bereavements that, as Kenneth Docker said, that are not socially acceptable, which grieving is complex, it triggers secondary variables like disenfranchised grief. So that's a more complex grief response when you don't feel as though your grief is valued because of the type of death. Certainly what we're hearing in our work in the community and in this Hospitals Trust COVID-19 response team is that we're hearing about rituals and belief systems being significantly disrupted. Now that was more so during March and April and May of last year, where funerals were either delayed by a significant amount of time, in some instances more than 8 weeks from death. Also, people's belief systems were significantly shifted, or their rituals through their belief systems was significantly had to be shifted, where they might well have wanted a burial, and that burial might have been within the first 24 or 48 hours, and they couldn't have that. And we do know, of course, that there were significant changes in the amount of people that could go to funerals. Now that's had, one way has been a case of, oh, that's been a big relief for people, not to have, in one of my clients' words, not to have the circus of organising a big funeral and wake afterwards. And in some, it has led to real problems with family dynamics on who to choose and who to leave out. And so rituals and beliefs have been significantly, as I say, disrupted during this time.
And 1 minute, Paul.
Thank you. So this has been really hard to hear, that people have felt as if they're like a statistic, that actually they might well have had a long-term illness and that was part of their identity. But in fact, when people have had COVID-19 on the death certificate, that has almost meant that that person has lost their identity. And that has also really complicated the grief response. People have projected a lot of anger towards other professionals instead of being able to reflect on their own grief response. And interestingly, people have also been thinking about self-disenfranchisement is an expansion to this idea of disenfranchised grief, where people decide on their own, because of their own guilt around the fact, well, my grief doesn't have any value because of all these people that are dying of COVID-19 in the world today. And so, as an implication to practice, it's really important for psychoeducation to, things like this, the week that we've got, to be able to talk about death, dying and grief, and combat the stigma and discrimination. And that's the end of my presentation, with a couple of up-to-date articles and information that obviously have got all about disenfranchised grief there. Thank you.
Paul, thank you very much for taking us through what I think resonates with so many, I suspect, on the call's experience of the last year. and just being able to have that sense of narrative around disenfranchisement, I think will ring true for many of us. So thank you for coming and sharing your thoughts. I'm delighted now to welcome Donna Hastings, who's the Child and Families Worker for St Columba's Hospice in Edinburgh, and who has been one of the originators of the bereavement chapter and has done a huge amount of work as a member of the working group. And Donna's going to share with us her thoughts on digital accessibility and the impact on grief. Donna.
Thanks, Donald. That was absolutely fascinating to hear, Paul, and I'm sure the breakout room for all the discussions will be great. I'm going to spend just 10 minutes talking about digital accessibility and the advantages that some people have found, but also some of the barriers that people have encountered. So I'm just going to share my screen with you. Can everybody see that? Yeah. Perfect. Okay. So I saw this headline, pay the Wi-Fi or feed the children. And it was obviously made to capture your attention. It was the University of Cambridge doing a study and looking at how the coronavirus has intensified the UK's digital divide. So just wanted to start by highlighting a couple of things that have been found in different reports. So Scotland's fragmented, isolated rural landscape and societal inequalities mean that many have less opportunities than others, and that these factors contribute to the issue of digital inequality being of particular concern across Scotland. And in 2017, the Scottish Government estimated that over a third of households in lower income brackets did not have any internet access at all. And it's estimated then that 800,000 people were estimated to face digital inequality. And you can see there that approximately 400,000 do not live in areas with 4G coverage. So this is just a small part of some of the reasons why people might not have been able to access support, bereavement support moving online. And we're just going to look at how some people and some services encountered this and how they were impacted during the pandemic. So some of the advantages that people felt were that they could access support and be at home in their own environment. So it was more comfortable for them than having to come into a building to get support. Less travel time, so that meant less time away from work or schools. And for a lot of professionals, it meant that time gained from travelling meant that they could fit more in and that there was more productivity. And for a lot of families, there was no building barriers. So if the support was in the hospital or the hospice, it can sometimes be a real comfort for people going back into the place where somebody died, but for others not so. And it can be a real barrier. And so if children and young people in particular are relying on an adult to take them to support, but that adult is struggling with accessing the building again because of the impact on their grief, then that impacts how a child is able to access their support. So one of the advantages of being online is that was removed. People also noted that in rural areas where perhaps before the pandemic people had struggled to find support, they could now access online and it was more accessible with more availability. And that some services extended their geographical reach. And this will also continue going forward for some services. However, one of the difficulties is that some services who have offered this support, they don't see it as being sustainable to their existing workload when face-to-face resumes. So a bit about how can we ensure that people who are in those rural areas can still access that, much needed bereavement support. Some places offered support later in the evening when, if there were children, they might be in bed, and so it was giving the adults then some space and time, which was seen as a real advantage. And supports have been available online or on the phone for both individual and group support. Some organisations are taking their training online, and again, it's saving time with people having to commute. And some blended support is now being offered to give people more choice about how they choose to access support going forward. So an extension of service provision for a lot of organisations across Scotland, that means that people can resume face-to-face if that's their choice, or they can continue to have telephone or virtual support. And some of the challenges that people have found is that for families working at home together, there might not have been enough of a quiet space for any bereavement support sessions to happen. If people are cramped into just using the space that they've got, or children maybe share rooms, then there wasn't the privacy that people were needing. When children were off school, parents were home working, maybe not enough devices to go around, and Wi-Fi wouldn't be as stable because so many people were trying to use it at one time. And some families just had no devices at all, or no Wi-Fi connection. Some services moved to phone or virtual, a mixture of both, but other services just stopped because of furlough. And then what happened to people's bereavement support at that time, if they weren't able to move to some kind of remote support? Initially, one of the school of thoughts was that people thought the pandemic would be over much sooner than it obviously has happened. And so people were opting to wait for face-to-face to resume. But actually, as time has gone on, people have realised that it's going to take a lot longer. And so the offer of these supports online have proved a lifeline for a lot of adults and families, and that's been the feedback we've been hearing. One of the challenges is no break between leaving a building following support and returning home. So, if you physically take yourself for counselling or for bereavement support somewhere, then, by the time that session ends and, you're either in the car or you're on the bus or even a walk to get home, you have that space of time to almost process what your support has been like. But for a lot of people, their experience has been when it's in the house, there's nowhere to go with it, especially if they come out and then they're having to go back to, looking after their children, or, there's other people around, and there's not that, I suppose, that process time. And due to furlough and redundancies, money has been tight and people have had to prioritise what their money has been spent on. And another challenge has been, again, that lack of space and privacy, people walking to the room or shouting through to one another, and just other distractions. And a lot of people have talked about a period of holding, and that the depth of therapeutic support in the beginning was less, although that's now changing a bit. And for some charities and organisations, the task of moving efficiently and safely online, some people managed that really well and others just weren't able to. Open University and the Online Therapy Institute offered some initial training so that people could move competently online. But there's a lot of services now saying that they will offer this extension of service, but actually for best practice, it's advised that people will do a more in-depth training to offer that, and that obviously comes at a cost. So we can't have gone round every service provision across Scotland, but a few colleagues have been really helpful in sharing some of the impact their service has seen during the pandemic, and been able to provide services remote to bereaved families. So held in our hearts, we're really kind to share all this information, and you can see the impact of the support that they were able to offer. And what they saw was a 54% increase in their befriending referrals, 21% increase in counselling. But most importantly, what they found was that 98% of their families were happy to convert to online support. Fiona Cruz was really kind again to share that their digital accessibility has gone really well with their adult service provision. Both telephone and virtual support are offered, and the uptake has been really good and has been successful. But they've found their children and young people service has been impacted, and that the move for digital has been a real barrier to support for some young people. And when we see places like Place to Be recognising that 1 in 6 children and young people can present with a mental health difficulty, then the fact that some young people are having real issues being able to connect with services, particularly for their grief, is an additional challenge for them. And what Cruz
1 minute, Donna.
Thank you. What Cruz found was that the number of children and young people receiving support was down by 50% on the previous year. And whether that was from not having devices or just the difficulties that moving online provided, is one of the things that we're keen to hear about. Interestingly, BACP in 2014 indicated that young people in age group 16 to 24 would be almost twice as likely as adults to choose counselling online over face-to-face. But actually that's not what
Donna, we seem to have...
has successfully moved online, and as an extension. Thank you. And just finishing up, really to have you thinking about the impact of this on the bereavement charter. Two of the main points is accessing support is seen as a right, and adequate bereavement support is accessible to everyone. But if that's the case, where does all of this impacted with digital accessibility and inequalities? Thank you.
Thank you, Donna, and sorry if I appear to interrupt you there, but you froze for a minute and I thought there was a technological drop. Thank you, Donna, and can I thank on everybody's behalf 3 fascinating presentations. One describing the dramatic change in the nature of place of death and raising significant questions around the quality of the dying experience and the impact on bereavement. Paul's presentation really highlighting the sense of disenfranchisement, which may be at the heart of many people's individual experience of death through COVID, if not directly from COVID. And there at the end, Donna raising both the real potential of online therapeutic intervention and support around bereavement, but also the challenging us in terms of digital impoverishment and digital accessibility. So I think we've hopefully had a lot of food for thought, and what we're now going to do is divide everybody, thankfully not physically, just metaphorically, into groups. And as I said, if once you get into your group, you really don't want to be there, come back to the main group and Shanice will try her best to reallocate you. Can I just say to the facilitators of each group that we're running slightly behind time, but we will use a full 25 minutes for a discussion. And then just to warn you, even if you're mid-sentence, you're electronically brought back here. So it's none of that, pick up your jackets, put your coffee down and come back to the room. You're forced back. So just to warn you of that, it's nothing personal. I hope you enjoy your discussion. Thank you.